Talk about is, eating disorders are going down into children younger and younger and younger and younger. And as a disclaimer, I am not a therapist, an adolescent therapist. I am not a expert in this, although I've treated a lot of people with eating disorders. We're not licensed to treat adolescents. The first 2 years I was here, like 35 years ago, we did treat adolescents, but I wouldn't take an adolescent without taking the mother. And some of those people, I mean, they're grown, they have kids, they have grandkids, and so it worked. But as the disclaimer, we don't really treat children with eating disorders or adolescents with eating disorders anymore. And there's an exception to that, is that on a private practice scale, we've treated, Kim and I have worked with a couple of families, several families, with this method that I want to tell you about. And it has worked wonderful if the parents will follow the directions. And it is really to help people recognize eating disorders and get their children help early. Because if you wait too long, you've waited too long. It will be so ingrained into their brain. And your children may have all kinds throughout their life, may have some eating problems, eating too much or eating too little or not liking certain things or want to skip meals, All kids will do that on a certain basis. I'm talking about kids that have eating disorders, that have problems that work into eating disorders, and how you can, be aware of it and what to do about it. And it's a different approach. It's a different approach. So just have a little open-minded, be open-minded because it is a very different approach. But we've used it with several families and it has been, they have seen wonderful results, but the key is to address the eating disorder as early as you can. So with that, the information, if you have teenagers or children that have any kind of eating problem, or you think that you know someone that does, this book, Help Your Teenager Beat an Eating Disorder. It is one of the best, and this is where this new, and it's not that new, it's just, it is a different approach to treating eating disorders in children and in adolescents. And I like it. I would never have, would never have thought this up on my own. The old school is you sort of separate the client. If the client is an adolescent or a child, you sort of separate them from the parents. The idea, and a lot of it is true, is, particularly little girls will grow up to have that father hunger and, yearning for that father figure. And a lot of little girls have problems with their mothers. We say, if it's not one thing, it's your mother. And all of that can be addressed, but not early on. Early on, and recognizing an eating disorder, it doesn't matter why. It does not matter why they are having eating problems. What matters is that you're able to recognize it and do something about it. And like I said, we have worked with several, and I love this approach. And I have two daughters. I have three daughters, but I have two daughters that, when they were adolescents, living in the home, I was practicing severe eating disorder, binge eating, and bulimia. and my two daughters were. I didn't know what it was. We didn't even know it had a name. I would just know they would get into my diet pills and into my laxatives, and I would just say, stay out of my bathroom. We never talked about what they were doing. In their weight, they'd get into a lot of competition about their weight and try to see who could lose the most and that type of thing. So I have had adolescents with eating disorders, did not know it was an eating disorder because I was knee deep in my own. So this is a good approach, and I wished I'd had it then. And I will tell you, in order to do this, it takes some pretty healthy parents. So with that, I want to give you some signs and symptoms first to look for. And most of you know these, but anyway, it's the warning signs of I can't even talk. The development of an eating disorder. Some of the signs are if you see your kid reading diet books. And by the way, if you have diet books laying around the house, you might want to get rid of them if you have kids. But if you see your child taking their allowance and buying diet books and reading diet books, that's one of the first symptoms. And then the evidence of visiting those pro-anorexia and eating disorder websites. I don't know if you know anything about them. I had the privilege of being on the Dr. Oz show with the man that created this pro-anorexia website. What he does is he teaches children, adolescents, how to have an eating disorder, which is, anyway, he was on there and I wanted to just slap him, but I couldn't do that. So that was many years ago. But if you have knowledge that they're on that website, be a parent. Take it off. That is one of the sickest things that can be happening that's available to children or adolescents. And then if you notice that they want to go on diets, if they have dieting behavior. It's not on here, but I will tell you, one of the things is, well, I'll wait because this is more about the recovery part, but I'll save that to last. But anyway, if they're already wanting to go on diets, grade school kids are wanting to go on diets, and grade school kids are making fun of other kids for being overweight or being fat, that type of thing. So another one is a sudden decision to become a vegetarian. I'm waiting on my very first anorexic to come into treatment. That's not a vegetarian. I mean, they're all, well, I'm a vegetarian, And when you really get to talking to them, no, they just don't eat certain things because they have more calories in them. So if your teenager or your, young child wants to become a vegetarian all of a sudden, that is something to pay attention to. Or if they all of a sudden have become a picky eater and want only healthy food, only healthy focus, and they want special health food, that is kind of an early sign. And then always going to the bathroom immediately after eating. I mean, that is a big sign of bulimia. And then taking multiple showers a day, because when people are in the binge purge cycle, they will get in the shower and can purge in the shower. I mean, we've always had a high plumbing bill over at Shades when we have several bulimics because I guess they think that we're idiots because we monitor them and all of that, but they can find a way to purge in the shower. So pay attention if they are taking multiple showers a day, your kids. And then if they have an unusual amount of stomach flu, if they're always complaining about their stomach, that's a good sign of bulimia and anorexia both. And then, of course, skipping meals is a big thing. And then if you have large amounts of food missing, like, maybe your adolescent won't eat breakfast, won't eat lunch, they kind of, pick around their dinner, and then they stay up at night. I mean, you get up the next morning and all the school stuff is gone, or I mean, they will eat massive amounts of food. That is a binger. A binge eater, I mean, they could eat 3 meals a day and still binge. And a binge is pretty high calorie. It's taking in a lot of food in a short period of time. And you couple that with finding ways to get rid of it, what that equals is bulimia. So these are some signs and symptoms for you to have to act now. Do not put it off when you see these signs and symptoms. And that is fasting or skipping meals regularly. Kids do not need to fast. If they are healthy eaters, I mean, you feed them healthy, they do not need to fast. If you have a child that's fasting, that is a sign of anorexia, early signs. And then refusing to eat with the family. Well, I've already eaten. I just, no. Then this is part of the solution, is have family meals together. But if your child is refusing to eat with the family, that's a good sign. And if you have a daughter that has skipped 2 periods, that is a big sign, because the weight loss will dictate that. And any binge eating episodes. I don't think we talk enough about binge eating. And because binge eating turns to obesity. Obesity is 30 BMI over 30. Morbid obesity is BMI over 40. I don't think we talk enough about binge eating. We're too, the focus really is on anorexia and bulimia. And there are more overweight children today than ever in the history of the United States. There's more obesity in our country than in any other country. And obesity is the #1 killer. And I don't think we talk enough about that. I think that kids that are, overweight, they just kind of laugh it off, that, parents do, or they'll fuss at them about their weight, or they'll just say, well, you're just like your grandmother, or you're sure getting fat, or you're this or that, instead of taking it as the serious problem that it is. And then so another thing is any purging episodes. When you know your child is purging, that's when you need to get help ASAP. If you discover diet pills or laxatives, that's when immediately you need to get help. And then excessive exercise, more than an hour a day, that also follows weight loss. Be aware of that. Get them help immediately if they are getting focused. Because bulimia, one of the ways that people practice bulimia is excessive exercise. And then refusing to allow others to fix their plates. That is a big signal. And then extreme calorie counting or portion control, weighing and measuring food. Now we're talking about adolescents and children. Being so particular about what they eat. And then refusing to eat with friends. All of those are, if you see this, signs and symptoms, this is about taking some action now. Now, one of the things, this new approach or different approach, it's been out for a while, and they have had, I can't even think of the word, but anyway, they have had evidence-based research on this, and there is a higher rate of recovery in this process with treating teenagers than any other process. And they're having, success rates up to 50%, which is high. I mean, very high. Anorexia is the highest form of, has the highest death rate of any psychiatric diagnosis. And across the board, the recovery rate for anorexia is pretty low. So this evidence-based approach, they're seeing 50% recovery, which is big, big. Okay, so what is this approach? You know, if your child had any other disease, if they had cancer or, I mean, you name the disease, you would be very involved in their treatment. You would probably be staying with them in the hospital, one parent. You would want to be talking to the doctors. You would want to know what they're doing, the procedures. You would want to be involved in the decision making. If your child was in a car wreck, you would absolutely be there to see what's happening. You wouldn't be necessarily wanting to know what caused the wreck. You'd want to know what's wrong with your child and get them to the hospital ASAP, and you would be there and be involved in their treatment. But you know what has happened in the field of eating disorders? Somewhere along the line, we got the idea, and we were taught this, is to, it's not about really blaming the parents. And I will tell you, many times there are things that go on in the family. It doesn't actually cause it, but it can certainly contribute to early eating disorders in adolescents. So, when your child gets bad enough to go to an eating disorder unit, they go alone. The family is not involved very little in their treatment. They'll have some family sessions. They'll work with the family. And invariably, you're gonna find some things, that maybe dad's a workaholic, he's gone all the time, maybe mother's a rager, maybe mother is a helicopter parent, or it could be the kids getting bullying in school. There's a lot of things that can create disappointment, depression and anxiety in a child that will start the eating disorder. But we were kind of taught to get to the root of the problem, and it's usually with adolescents, there's something going on in the family. This process is don't bother with that now. It's not important. Later on, down the line, year or so in good recovery, then come back and and look at the family system, but not early on. And now with adults, you better look at the family system that they came from early on in recovery, but not with adolescents, and get the family involved. Now, this is what is the new approach. And I want to tell you about a family that we worked with several years ago. And in fact, there is a story in this book almost identical to that family that we worked with. And we happen to know the father. He used to work for Shays many years ago on a contract basis. And he called us and had a 14-year-old anorexic daughter refusing to eat, and she was a swimmer. And she was a good swimmer, very good, outstanding. But she had been asked, the parents had been called that she could no longer work out or be on the swimming team because of her weight was so compromised. And, the parents were busy, they were working, and they had noticed her losing weight, but had really not addressed the weight loss until they heard from this swim team. And they would not let her back into the gym or, where the practices were until until her weight was addressed. So that's what the call that we got. So I had read this book, and they were the first ones that we did this with. And so we did this as private therapist over on another piece of property of ours. We worked with the family for about 4 days, the mom and dad. She was an only child. So we brought the family in. And this is the part that is different. You must get the family involved in the process, because you teach the family to start taking charge of the refeeding of the child. Now see, that's what's different. And it takes a willing family, and it takes a lot of negotiation with with their jobs, and I mean it takes a lot of willingness for a family to go this way. So back to this family. And their daughter's weight was really compromised. She was seeing a dietitian. She was seeing a therapist. By the way, when you see that your child, I'm going to back up a minute, when you see that your child has some of these symptoms, yes, you will probably want to take them to your medical doctor and maybe the pediatrician, but do not depend on them for much guidance about an eating disorder unless they specialize in eating disorders. I am not faulting doctors. They do not know about eating disorders. And until they are very, very severe, they really won't have a lot of recommendations. So the reason you take them to the doctor, their medical doctor, their family practice doctor or the pediatrician, is to get a good medical write-up. Have tests run to see where you are with blood work and all. So that's where the medical people come in. And then you need to get an eating disorder specialist. And sometimes they are far and few between. And you've got to be willing to go outside of your immediate area. If you live in a small town, you're going to have to go outside of your immediate area to find a specialist, an eating disorder specialist that can help diagnose your adolescents or your child, because most doctors don't, and and they don't treat it. And so, I'm not putting doctors down, and even pediatricians, they do not know, many of them, like I said, I've worn that out, unless they have specialized training. Okay, so back to this family. She was an only child. It was summertime, and so this was, she was out of school anyway, but getting ready to start back to school, and they wasn't going to let her be on the team. They were not going to let her swim. And so her mom and dad and they came for 4 days. We worked with them every day for 4 days. And the first thing we had them to do is, after we did kind of that morning sort of some introduction, we had them go to lunch. Didn't say anything about where or what, how to do it, but to go to lunch. And they were way late getting back. And when they came in, they looked so frustrated. And the mother was crying, and the dad was angry, and the little girl just had her held up high, like, well, I won that bout. And so I asked him, I said, what's going on? And the dad said, we have spent this entire time waiting for her to pick out a place to eat. And that's the daughter. Everywhere we'd stop, she would go in and look. No, I don't want to eat here. I don't want to eat here. And so I had the daughter to show us. I said, show us what this 2.5 hours has looked like. So she set up chairs like in the car. The mother was in the back. The daughter wanted to sit up front. She was sitting up there with Dad. They put the mother in the back. The daughter was up there. The daughter was in total charge of where they were going to eat for lunch. And then once she finally found a place that she would go into, then it was total hell to get her to order something. And then it was even worse to get her to eat it. So, there lies the problem. And we saw the problem right there. The daughter was in total charge of the family and had been for quite a while. The dad was had bought a new company. He was working hard, gone lots of hours. Mother was working, gone a lot, supporting this new business. They were busy people. And we worked with them for 4 days and got to see, what their life looked like. And then the approach, this new approach, is for the parents to take the refeeding of the child over. And this is where you have to really work with the parents and get them on board. And any family that is in the area, like this child had two grandparents that were, I mean, just doted over her. They were both retired, so I had them to call them, and they got on board. And how you get on board is one of the things is it was almost like setting up an outpatient program in the home. The child stayed at home. She didn't run around with her friends. She didn't get outside exercising. She stayed in the house, conserved all of her energy. The parents prepared the meals and they sat down with her and ate. They fixed her plate and they ate every meal with her. And the dad had been in the addiction field for years and he knew the seriousness of it. And he put his business on hold for them to do this for 2 months. And I'll tell you, she not only got back, her weight got back into a normal weight range. She got back on the swimming team. She excelled. She won scholarships. She's doing great and has really never had another side of anorexia. And that's because the parents and the grandparents got serious enough to take the time. And I'm already hearing you say, well, we can't do that. We can't take off of work. They took, they were self-employed. Now the wife took medical leave, family medical leave. Because they're dealing with a disease that is as dangerous as cancer or any other disease can be thought of. So when they did have to get out on their jobs, then that's where the grandparents came in. But you have to get the grandparents or the aunts and uncles, anyone that will be on board. You have to get them all on the same page. You got to go over the food plan with them. They have got to be on board to cook the food, serve the food, sit with the child while they eat, whether it takes 2 hours or whatever it takes. And so we've done that with several families, and we're seeing really, really good results. And what we're seeing so many times is that and like I said, this is not the parents' fault. Do not, there may be some things going on in the family that needs to be addressed. But it's right now, the early part of it is the emergency is getting the patient refed. Now, that is on the anorexic side. Now, on the bulimic side, there again, homeschool them. If they're in school, take them out and homeschool them. If you've got a child that is a bulimic, you cannot send them to school and trust that they won't binge and purge. What they'll do at school is eat off of their tray and go around and eat off of the other kids' trays, then go to the bathroom and purge. So what this looks like is you take them out of school, 2 months, homeschool them, and feed them at home 3 meals a day and a snack at night. Work with a good dietitian. Another thing, in order if their weight is compromised, and what I mean by that, if their weight is low or too much, then you need to work with a dietitian. Because in order for the anorexic to regain, you're going to have to, and we hate to speak in calories, but you're going to have to get the volume of food up. And so in order for them to regain, now they can eat, a balanced meal and stay the same weight, but you're going to have to get those portions up in order for them to gain any weight. And that's where a good dietitian comes in, because she can or he can help with condensed calories, food that has really condensed calories where the volume is not so much. So the food piece is the focus here. It is like if your child was on drugs and alcohol, you would not let them have drugs and alcohol, And this is a different approach, an entirely different approach. But what we see is when the family's willing to do this, the family gets to see their own family problems, their own issues, where if the mom and dad are staying home together, and that's really what we recommend, if that is at all possible, to take 30 days off and the parents stay at home with their child for 30 days. And I know that's asking a lot, but if both of you can't do it, one or trade off. And it would be so worth it on the front end. Now, on the other end of anorexia is binge eating that turns to morbid obesity. Like I said, we have got a country full of obese children, and there is a lot of attention that is given to anorexics because, you look at them and they look like skeletons. They look scary if their weight is compromised. But you see an overweight child, kids bully them at school, they make fun of them, they put them down, the kids want to kill themselves because they're being bullied, and then they go home and eat over it. This is where the parents are responsible. They're responsible for the snacks they keep in the house. They're responsible for the meals they keep. And the binge eating takes place usually after school and at night. And when they are binge eating, how you can tell is if their weight's going up. And I can hear people say, well, they're a growing boy or they're a growing girl. Yeah, and they're overweight. They're overweight. I see children little children that are morbidly obese, and their parents are in total charge of their food. And that is a form of child abuse, to let a child get morbidly obese. And I don't care what age they are. It is a form of child abuse to allow them to get morbidly or to get obese. And when children are 12 or 13, when they're going into pre-puberty, a lot of times they'll gain a little weight. Some of them do, some of them don't, but some of them keep it, and they keep adding more weight and adding more weight. And it's not about how they look, it is about their health. And if you don't address the binge eating early on, they'll come to us when they're in their 20s weighing 300 pounds or in their 30s weighing 400 pounds or whatever. Look at the binge eating, and so when you do that, many times the family, at least one parent, is overweight, and food is not. It doesn't have to be. It's not like you have to be the police, the food police. It is about you feed your family healthy. Don't bring anything in that's not healthy. I'm not saying don't let kids have sweets, but let them have it in a controlled. There's that word control, but have it at mealtime, something, put it in the meal plan, because if you don't, we see many adolescents start their eating disorder being overweight and being made fun of. And then they'll go from not eating. And they don't have to be a lot overweight. If they're being made fun of at school, they'll start skipping lunch and then breakfast. And then before you know it, people are talking about how good they look because they're losing weight. And then before you know it, they're in full-blown anorexia. And there are reasons that, and I'll just say a few, that kids do have eating disorders. One of them is any change. Notice where there's any change in the family. One of the things that, this is years and years and years ago, this family had a daughter. She was 13. They had several kids, and they had an older daughter and a younger daughter. And the older daughter was in high school, and the younger one was 13, and they shared a room together. And the 13-year-old loved and adored her older sister. Her older sister was very good to her, would let her hang out at times with her friends, and it was a good relationship. This is a story that is not very many people have, but the father had an aunt that didn't have any relatives, didn't have any children, and she was wealthy, and when she died, he inherited her wealth. and they'd had just a bungalow. I mean, a nice little home. It was ranch style, 3 bedroom, kind of cramped, with a family. So the first thing they did was build a huge house because they could afford it. A 2-story, huge house. On one end of the upstairs was the oldest daughter's bedroom. On the other end of the upstairs was the youngest daughter's bedrooms. The son's bedrooms was in between. They all had a bedroom. And that little girl was back down there by herself for the first time in her life. And what she did, she got depressed, she got into anxiety, she stopped eating, she got into anorexia. And what it was she was missing her sister. And, all of this had come out so quick, had happened so quick about the money. And the parents were so excited. And then the new house. What I'm saying is bring your children along in the conversation with the change. Change is something that can bring on eating disorders for children. Change, and adults too. But talk to your kids. Have conversations with your kids. Let them talk about their feelings. Grieve the old house. Even, when you've lived in a house for a long time, even if it is, too small or whatever, there's a lot of memories there. And so grieve the old house. Have a ritual, to grieve the old house. And these parents, no fault of theirs. They were just excited about this new house. And the child carried the pain of the grief of leaving her childhood home. So that's just one instant. I could give you many, many more. So, in essence, there's a lot in this book. If you have children coming up and they're already, little preschool kids, and they're already talking about, they're fat, or they want to go on a diet, or they're in grade school, I would recommend you get this book. Help your teenager overcome an eating disorder. And it was written by 2 PhDs and in their work in the eating disorder field. And in the back, there are places where you can contact people to find, adolescent therapists. They're few and far between, but they're out there. And so I know this is just a short thumbnail sketch of this book, but the primary thing is for the parents to take over working with the doctor, for the medical, and working with the therapist for the on the therapy side, but for autonomy purposes, let the child see the therapist by herself or himself, and then add the parents in there. But the child needs an opportunity to have someone that they can talk with, and a really good therapist trained in eating disorder and trained in eating disorders will be able to talk, very objectively with the child and get to some core issues of where the eating disorder started. And I will tell you, a lot of it is in school bullying, and it has nothing to do with the parents. Sometimes there's conflict in the family. Another thing you can look for is when parents are into lookism, wanting to look a certain way, where if dad talks about mom's body, that absolutely will set your kid up to have an eating disorder, or if the dad talks about the child's body, aren't you gaining a little weight there? Be careful what you say to these. They have sensitive little hearts, and don't talk about the weight in the body, how a person looks, because that they take it to heart. Talk about what they're doing in school, talk about their sports, talk about what they want to do when they grow up, or what they want to study, or the go outside and play in the leaves. Do something active with your children, but don't talk about bodies, and that one body is better than the other body. Don't compare your children to each other, because their body is built different. But I do want to say, yes, anorexia is very serious. Bulimia is very serious. But do not overlook the binge eating and the overweight child, because down the road, if they get fed up enough, they can go the other way and become anorexic, because we see it all the time. All right, so that's what I have, and like I said, it is just a thumbnail sketch. There's a lot to it, but that is the basic, is for the parents to take over, not in a, I mean, sometimes you have to be pretty dominating, but it is a, I am your parent, you are sick, this is an illness, I'm going to help take care of you. We've got a team. We've got a doctor that's helping you with your medical problems. We've got a dietitian, and we have a good therapist. Your dad and I, or your mom and I, are part of the team. Your grandparents are part of the team. You make sure everyone that is part of the team are on the same page, that they're not, each have their own belief system. So that's what I have to say. Any of you have anything to add or to ask, or if you have children that you want to ask questions about, or would you like to have had some help with your own eating disorder when you were younger? So let's talk.
Jenny,
Uh-huh.